Welcome to Herbally Yours, an adventure into the world of natural medicine. Here is your host, Dr. Ellen Kamai, the natural nurse who will help you take the leap to ultimate wellness.
And greetings. Thank you for joining me, Ellen Kamai, the natural nurse, for another edition of Herbally Yours, right here on the voice of Nassau Community College, 90.3 WHPC. Herbally Yours brings you the latest information about the many facets in the world of natural living. Today, I am so happy to have as our guest Dr. Anna Garrett. Dr. Garrett has been a clinical pharmacist for over 20 years and has worked in a variety of settings. While traveling her career path, she discovered that working with women, particularly in midlife, is her true passion. She offers a variety of services, including hormone balancing, weight loss, and health coaching, designed to help women in perimenopause and menopause escape from what she calls hormone hell and feel amazing in their bodies so they can rock their mojo through midlife and beyond. Dr. Anna is passionate not only about helping women get their hormones balanced, but also teaching how to advocate for themselves in the healthcare system. She received her Bachelor of Science and Doctor of Pharmacy degrees from UNC Chapel Hill and is a board-certified pharmacotherapy specialist and also a certified intrinsic coach. And she has studied through the American Academy of Anti-Aging Medicine. Thank you so much for joining us today, Dr. Garrett.
Well, I'm excited to be here, Ellen. Thanks for having me.
And I'd like our listeners to know that they can find you at drannagaret.com. That's Anna, A-N-N-A, Garrett.com. And you will find this all on our archive for quick clicking. So again, thank you for joining us. Now, I know you've been involved in this project many years, and it's been your passion. But tell us about your new book that just came out.
Well, I launched a book on April 7th, and it is called Perimenopause, The Savvy Sister's Guide to Hormone Harmony, and it's available on Amazon, Barnes & Noble, Kobo, just about everywhere. And I wrote this book because what I've realized over the years is that so many women have no idea that perimenopause is even a thing and that it's coming. Because 100% of women, if they live long enough, will go through this transition. And so I wanted it to be the what to expect when you're expecting for perimenopause, because I just remember, you know, when I found out that I was expecting my daughter, the first thing I did was run out to the store and buy what to expect when you're expecting. And so my wish is that this book can become that for the other end of the reproductive spectrum.
Right, the cycles of life. In fact, that's why one of the books I wrote is called Cycles of Life, because I discuss all that, such as pregnancy, fertility, and then also menarche. You know, I think that is very unrecognized. Maybe you want to write a book about that too, because that is where women start cycling for the first time. That's a hectic time of life. And you're looking at the perimenopause. And as you said, what does that mean, perimenopause?
So perimenopause is the whole 5 to 10 years on average that span from the time your hormones start to shift in your late 30s and early 40s all the way to menopause, which is the average age is 51. So it's anything from, say, 40 to 50. And it's characterized by big swings in hormones. And so your progesterone is the first to go, and then that allows estrogen to run the show in your body all month, which results in weight gain and breast tenderness and flooding periods and all of these things that sneak up on women, and they wonder, you know, what is wrong with me? Well, the truth is nothing is wrong with you. You've just entered a new phase of your reproductive life. And I think it's important that women understand what's coming so that they aren't alarmed and confused and scared. and that they know what steps they can take on their own to help manage all of what's going on.
Yes, those are good suggestions. Like, for instance, recognizing. I find that many women, especially when they're younger, they're quite shocked and, somewhat horrified to think that this can be a 10-year span. This is not a couple months.
Right. Yeah, that's true. My stepdaughter was here this weekend, and she's 41, and I dedicated the book to her and my other two daughters, and we were just talking about what's going on with her, and she's like, I didn't know any of this stuff. And women who are that age, maybe even considering having other children, they're busy living their lives, and so these things just, come out of nowhere, especially the emotional part, like mood swings or depression and fatigue that they just can't manage. And they have no idea what is happening. And so they'll go to their doctors and say, what's going on? The doctor will say, oh, you're too young to be in perimenopause. And they'll write them a prescription for birth control pills or antidepressants or anti-anxiety medications and send them on their way, when the truth is there's an underlying hormone imbalance that actually could be corrected and make all of those medications unnecessary.
Wow. And so you talking about medications unnecessary is excellent, because you are a highly trained pharmacist.
Well, I am, but I believe in using medications judiciously and not as Band-Aids for root causes that can be addressed. So I do have a little bit of a different viewpoint, but I just know that, from the clients I've worked with, that there's another way. And I'm not saying that antidepressants are bad or that I'm against them. I just think that a deeper dive needs to be done into someone's hormonal health rather than just giving the antidepressant and moving on.
Well, I know since you have studied with the anti-aging medicine group, and I've been with them since it's got to be the 1970s when they were joining together. Dr. Serafina Corsello was one of the initiators of that, and also the chelation therapy group. And I was her head nurse in those years. So it goes back a long way. And they're always looking at the fact that we want to find the cause rather than, okay, this is happening, give you this drug. Drug might be needed, but why don't we do some testing and see what's going on first?
Exactly. And so that's part of what I do in my practice. I offer testing. And many women will go to their doctor and ask to have their hormones tested, and the doctor will tell them, oh, it's not useful, your hormones are changing all the time, it's not going to be helpful. Well, that usually is a tip-off to me that they don't really know what to do with the results. But as it's possible to see the magnitude of imbalances, yes, your hormones do change, but it doesn't mean that a test is useless. All lab tests are a snapshot in time. So, I don't know why this is any different. It's just that a lot of doctors aren't trained in how to treat women in perimenopause and menopause. And, when your average physician visit is 7 minutes, there's not much time to really get into root causes of anything. So it's frustrating for everybody, and it's not the doctor's fault. It's just partly the way the medical system is set up, that there's no real incentive for them to go out and study and become more savvy in how they treat women who are experiencing hormone imbalances.
Well, I'd like to remind you that you're listening to Herbally Yours on the voice of Nassau Community College, 90.3 WHPC. I'm Ellen Kamai, the natural nurse, and my guest today is Dr. Anna Garrett, author of Perimenopause, The Savvy Sister's Guide to Hormone Harmony. I love that, hormone harmony, because that's kind of what you're talking about. Hormones are not static. They like dancing.
Yeah, exactly. I describe them as a symphony, and when one of the instruments gets out of tune, then everybody gets out of tune, and so they're also intricately related. That I think people think, it's just one thing that's going on, but it really isn't. So, for instance, if your estrogen is high in perimenopause, it not only causes problems on its own, but it can make your thyroid function seem low, when actually it's just the estrogen that's blocking the activity. So there's a lot of those sort of interplays that go on that need to be identified so that the right steps can be taken to get somebody back in balance.
Well, if you were doing hormone testing, would you look at only estradiol, or do you expand to more of the variations of estrogen?
So I use the Dutch test, which is a dried urine test, and it gives me estradiol, estrone, and estriol. So I can see all three of them, and then the metabolic pathways that they travel to be eliminated from the body. So I love that test because it's just it's an overwhelming amount of information, and it takes a professional to interpret it. So it's a little disappointing that people can actually buy that online for themselves and then not know what to do with it. But I don't care for that so much. But it's really an incredible amount of information that can give us interventions that can get somebody on the road to feeling a lot better.
And that is so much better to have a professional like yourself interpret a blood test that's meaningful rather than, like you talked about, hormones. It gets me absolutely nuts when a person gets a regular conventional blood test, and for instance with the thyroid, it will say their TSH is normal, and even though they have a long list of things that could be linked to thyroid dysfunction, they're told their thyroid is normal because thyroid stimulating hormone might be within normal range, but that's not even a thyroid hormone. So how can doctors say that?
And the other part of that is that the range that is used in most labs now is really outdated. And the American Society of Endocrinologists has recommended that range be changed to have an upper limit of normal of 3. And a lot of labs are still using 5 or 5.5 as their upper limit of normal. And you're right, TSH is not a thyroid hormone. It comes from the brain. And there are people that can have perfectly normal TSHs and still feel awful because their actual thyroid hormones were off, or something else like estrogen is blocking the function. So I am not a big fan of treating numbers. I think, if somebody's sitting in front of you telling you that they have a laundry list of things that sound like hypothyroidism, where's the harm in trying something to support the thyroid? It's not like you're getting married to it. You can always stop it if it doesn't work out. But I know that hypothyroidism is really undertreated in this country, and it affects women, by and large. What is it, 80% of women are, not 80% are hypothyroid, but 80% of cases of hypothyroidism happen in women.
Yes, and I want you to know, we're going to take a little break right here, Dr. Anna Garrett, and you are listening to Herbally Yours on the Voice of Nassau Community College, 90.3 WHPC. You can listen live online at nccradio.org or on iHeartRadio. I love listening to us on iHeartRadio. I've tried that lots of times. For more information on today's guest or topic, email us at whpc@ncc.edu. Stay tuned. Herbally Yours. We'll be right back.
Hey, y'all. Jeff Foxworthy here. Now, if you've ever found yourself repeating the same thing over and over for 75 years, you might be Smokey Bear.
Only you can prevent wildfires.
That's why I'm filling in for Smokey to switch things up, because there's a lot more to say. And I should know because my grandfather was a firefighter. And one of the things he taught me is that the people that love the outdoors the most are often the ones accidentally starting wildfires, which means always BYOB. No, bring your own bucket to the campfire. And be extra careful with things like burning yard trimmings. Don't just walk away, or chances are you might be starting a wildfire. So for the love of the outdoors, go to SmokeyBear.com to learn more about wildfire prevention. Brought to you by the U.S. Forest Service, your state forester, and the Ad Council.
And thank you so much for listening today, and you are with us right here on Herbally Yours on the voice of Nassau Community College, 90.3 WHPC. I'm your host, Ellen Kamai, the natural nurse, and my guest today is Dr. Anna Garrett, who is a highly trained pharmacist and also does private consultations by phone as well, if you're interested in having her help you organize your hormones into harmony. And she's also the author of Perimenopause, the Savvy Sister's Guide to Hormone Harmony. So what are some of the tips that you give in your book, Dr. Anna?
There's quite a few. So what I generally start with my clients, and what I recommend for everyone, is to take a really careful look at lifestyle when you are starting to experience hormone imbalances, because there are a number of lifestyle changes you can make that are really simple. They're not expensive, and they can make a world of difference. So, for instance, looking at nutrition and eliminating sugar and perhaps dairy and wheat, and giving that a trial to see how that affects symptoms like hot flashes and joint pain. Getting good sleep, and sleep is a challenge for women in perimenopause, and a lot of them tell me, well, if I could sleep, I would. But getting good sleep is critical. Eliminating alcohol if you have issues with hot flashes, breast tenderness, night sweats. That can be particularly effective because alcohol raises estrogen levels and also plays havoc with your blood sugar in the middle of the night. So those are a few of the nutritional tips that I give people. And then there are some supplements that I like to recommend, as appropriate for the particular case. So I'm fond of Vitex for people that have low progesterone to help balance that out.
So let's talk a little bit about that. That's a wonderful herb. I grow it in my yard because I do most of my herbs wildcrafted, but of course you can also purchase it as a herbal product. What do you like about Vitex?
Well, I like that it's a non-hormonal way to help balance out the estrogen and progesterone ratio, and it works, I have found, really well for women who are newly in perimenopause. Maybe not quite as helpful the farther you are in. But, it doesn't have a lot of side effects. It works well. I mean, it does take maybe 2 to 3 months for a cycle to kind of settle down, but it's just a really nice low-risk approach to getting those two hormones back in balance.
Let me ask you a question, because I'm interested in your comments, because I think soy is an interesting thing to look at, because there is some really good science, but then again, we would like to stay with organic soy. But what is your feeling in terms of the usefulness of soy in perimenopause and menopause?
Well, I would say in perimenopause, because soy has some estrogenic properties and perimenopause is characterized by estrogen overload pretty much, that's probably not a good first choice. But in menopause, it actually can be helpful for some women. I prefer fermented sources of soy versus, something you can just go and buy off the shelf. And I know there's a lot of controversy about that. I don't recommend it all that often because usually there are other alternatives that come to mind first.
That's a good answer, and it's true. There's some really, really strong science supporting the use of soy, particularly for perimenopausal women, while it might be contraindicated, let's say, for baby boys who are having formula. These are different people.
Right.
But on the other hand, there's other things that perhaps have less controversy around them that might be a better choice. And like you're saying, in every case, you're looking at the individual rather than like the numbers and the stats.
Exactly. And, I want to meet the client where she is. And, some people have very definite opinions about what they will and won't do. And, I certainly honor that. I mean, everybody's journey is different, and everybody's choices are different. And I don't think anybody's choices are right or wrong, but I do want them to understand kind of what the data says, and then they can make a more informed choice rather than just going with something that they picked up in a Facebook group, for instance.
Yes, that's so true. And, that's a very balanced approach. And that comes from your years of experience and your years of study. And it's great that you actually can offer this service at a distance.
Yeah, it's great. I love to use Zoom, which is a video platform. If your listeners aren't familiar with it, that, it's like we're sitting in the room together. And I love to use that, and it's a great way, and it's a great resource for women who may live in areas where there aren't hormone specialists that they can go see, or they want a different approach that doesn't involve Western medicine. Because I get quite a few women who are just like, I'm done with regular doctors. I want something different for myself.
But also you can do both, because you could have your conventional, even gynecologist, do some tests for you that are going to be covered under your health insurance, but they're not going to have the expansive experience and protocol management that someone like yourself has, which they can use in addition to their gynecologist. Sure. Doesn't have to be a choice, one or the other. And I'd like to remind you listeners, you are listening to Herbally Yours on the voice of Nassau Community College, 90.3 WHPC. I'm Ellen Kamai, the natural nurse, and my guest today is Dr. Anna Garrett, and she has a new book called Perimenopause, The Savvy Sister's Guide to Hormone Harmony, which I just love. What is the relationship for testosterone for women, Dr. Garrett?
I think testosterone is actually critical for women. It gives them, muscle tone. It helps bone health. It gives them, drive to accomplish. So it gives us all the things it gives men. Hopefully, not the facial hair and all those things, but it's critical for overall feeling of well-being. And I think it's overlooked a lot. I have had so many clients who just their testosterone was almost non-existent, and I worked with their doctors to get them put on that, and it just made a world of difference. In fact, I started on it myself about 8 weeks ago, just because I just, didn't feel quite right, and I tested myself, and sure enough, no testosterone. So I think it's very important for women's well-being.
Yeah, and it is part of the natural picture. Although people think of testosterone as being the male hormone, all women have testosterone, just like all men have different, what would be considered female hormones. It's just the balance. And that's what's so lovely about the name of your book, because you're talking about hormone harmony.
Exactly. I forgot what I was going to say.
Well, just basically that all of these hormones really are present in everyone, and through testing you could determine an individual's level and how you might balance it naturally as well. So that goes along with the harmony.
Yeah, women have much less testosterone, and there are no commercially available products for women. They all have to be compounded at this point. And it's easy to overdo dosing in testosterone, so I always like to recommend a low dose to start with if somebody wants to do replacement.
Right, and you can also start with herbals. There are some really well-established herbal remedies that help support your body's production of testosterone, such as, for instance, ginseng and also deer antler velvet. And those are very mild. Obviously, you can't dose so specifically like you can with an isolate, but very often they'll just kick on the body's ability to reestablish its own production. So that's a good thing to consider trying. It's usually used for men, but it can be used with women as well. So in your book, what did you mean by harmony?
Just that all of the hormones are playing well together so that cortisol is nice and balanced, and then that helps even out all of the other hormones. And the woman who, was once finding herself in hormone hell is now feeling at home in her body again and able to live a quality of life that she wants for herself and her family. So that really is the ultimate goal, is to have her be happy with herself and her ability to contribute to her work life or her family life or, whatever it is she wants to do.
Well, wow, you talked about a lot of very important things. And when you're discussing something like cortisol, that is big because that's the stress hormone. What are some ways that we can help to bring that down so we don't have cortisol raging?
Well, the most important thing to do is stress management, and that's easier said than done for a lot of women because they live such hectic lifestyles. But I think it's important to start with, putting your life under a microscope and saying, these are my top 3 priorities and everything else is going to have to go to the wayside right now. Because if you don't manage your stress, there's really no way to supplement yourself out of a cortisol issue, at least not that I've found. Now, I will say that adaptogenic herbs are super helpful for helping support that process, but you really have to get into looking at what is going on in your life and what needs to change in addition to the vitamin or herbal support that you choose to use.
Yeah, and sometimes we know what has to change, but, you're just not in a position to change it at that period of time. Right, like let's say, you have to quit your job. Well, that's good, but then it's going to be very stressful about not being able to pay bills.
Right.
So, there's a balance there. And that's why stress reduction techniques, along with things like adaptogenic herbs, as you said, Dr. Garrett, are so important, like deep breathing techniques, which you can do. Yoga, if you can't get to a class, you can do it at home for 15 minutes on YouTube, on your TV. But you do have to do it. It's a matter of, self-discipline and commitment to the importance of helping yourself.
Yes, definitely.
Which is not always the easiest thing, but, people can do it. So we're almost at the end of our time together, Dr. Garrett, so please just reach out to our listeners and let them know, again, how they can get in touch with you.
Well, my website is www.drdr.Anna, A-N-N-A, Garrett, GARRETT.com. I offer a free download of the first chapter of my book on my website. So that's something that your listeners can take advantage of. And then I also have a perimenopause quiz on there. If one of your listeners is confused about where she might be in the transition, this is a good way to sort that out. It gives you a simple score, and then I send some resources after the quiz comes in that are appropriate for whatever stage you're in.
Okay, well, thank you so much, Dr. Garrett, and thank you, listeners, for tuning into Herbally Yours, produced in the studios of 90.3 WHPC, Nassau Community College, Garden City, New York. For further information, email us at whpc@ncc.edu. This is your host, Ellen Kamai, at naturalnurse.com, inviting you to join us next week for another edition of Herbally Yours. Until then, stay healthy.